In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Task Force for Combating Coronavirus COVID-19, His Excellency Dr. Walid Al-Mania, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamil Al-Salman, Infectious and Internal Disease Consultant at Salmani Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, as usual, we begin with Dr. Walid Al-Mania. Please proceed. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within his knowledge. Praise be to him for his countless blessings and grace. And praise be to the Prophet. We welcome you again to this press conference through which we aim at informing you on the most recent updates, and we confirm that the collaboration of everyone is the only means towards achieving our goals. And in order to combat COVID-19, the press conference today is going to have 5 main pillars. First, we're going to review the executive plan of the royal decision to vaccinate citizens abroad, and we're also going to review the efforts of the National Medical Task Force and the decisions in this regard, and then we're going to review the medical protocol for the vaccine, and fourth, we're going to talk about the updates of the national campaign for all ages, especially children, and also we're going to answer all the inquiries received from citizens and residents, either from email or from the frequently asked questions on social media. In implementing the royal directives of His Majesty, may God protect him, to vaccinate Bahraini citizens residing abroad who did not have the chance to get the vaccine, the Ministry of Health and Ministry of Foreign Affairs have coordinated to set a plan for this order, and starting from yesterday, an extensive coordination has been made with the embassies of Bahrain abroad in order to vaccinate the citizens according to the regulations, domestic regulations, and to ensure the electronic access for citizens. And also the Ministry of Health has set the necessary coordination in terms of logistics in order to transfer the vaccines to the citizens abroad. The plan is going to be implemented over the coming days after limiting the number of citizens and getting the necessary approvals. And thank God, and out of the sense of responsibility by everyone, we are witnessing a remarkable decrease in the number of active cases following the decisions issued by the National Medical Task Force on the 27th of May. And we are going in the right direction. And we would like to note that the number of active cases in the 28th of May, around 19,238, and then they decreased until to 19,800. This confirms that the decisions were right, and therefore, following the review of the government executive committee, it has been decided yesterday that for a period of 2 weeks, starting from Friday 25th, the previous decisions were extended following the positive results, and the gradual opening of these sectors are going to be based on the updates. However, these decisions are not the only indicator or the only means to achieve our goal. We have to get the sense of individual responsibility and the collaboration of everyone for the sake of Bahrain and all their citizens and residents. And we note that starting from Wednesday, 9th of June, active cases implementing home self-isolation and who need medical care will be received at the newly established Medical Center at Bahrain International Exhibition and Conference Center by going directly there. So we repeat that implementing the precautionary measures and guidelines is the thing that is going to make the difference. So it is the responsibility of everyone. They collaborate and extensively implement the decisions for the sake of achieving health and safety of everyone. Now, I'll leave the floor to Lieutenant Colonel Dr. Manaf Al-Qahtani, infectious disease consultant at the BDF Hospital, who's going to talk about the third pillar, which is about the protocol for the booster dose for coronavirus. Thank you very much, Dr. Walid Al-Mana, in the name of God, most gracious, most merciful. Good afternoon, everyone. After listening to what Dr. Walid Al-Mana, I remembered what God said. It is the right of everyone living in the Kingdom of Bahrain to feel proud that they're living in this beloved land, because the Kingdom of Bahrain has really succeeded in setting all the procedures for coronavirus since the beginning in terms of isolation, treatment, and we are coping with all the updates and changes with determination. And as mentioned by Dr. Walid, I'm going to talk about the third pillar, about the treatment protocol related to the booster dose. And then Dr. Jamila Salman is going to talk about the fourth pillar, all the updates related to the national campaign for vaccination. Well, Bahrain has always been on top of countries that protect the health and safety of everyone. And out of this, we started implementing the strategy, the second strategy, which is providing the booster dose. And allow me today to talk in details about this, to define the booster dose and the factors. Well, the booster dose, was decided according to national statistics and was also in line with statistics and scientific results about the booster dose, whether within these studies or previous ones. Generally, the definition of a booster dose is to make the immunity within the system strengthened and improved in order to combat the virus. The reasons for the booster dose, there are main two reasons. First, to strengthen the immunity within the human body, which would vary from one person to another depending on the time. Not to mention, if we have a pandemic that is going for more than 2 years, and this leads to the second reason. In light of having this pandemic, it means that this virus is going to have variants, and the best method to stop this virus and variants is to take the boosters. So many regular vaccines like tetanus, pertussis, for other diseases, for different diseases, these are regular that we took before, and so the booster dose is not like a new science. It is existing long time ago, but by chance during this pandemic it has been updated according to the regional and local context. But the question is always asked, which vaccine do you recommend for booster dose after taking the two doses? Let's say like the majority of Bahraini residents took the Sinopharm. Let me point out, each country has its own factors and reasons in updating their doses and times. So according to our factors, it has been like we reviewed all the studies in the Kingdom of Bahrain for 3 months, and we limited them to the following. Sinopharm is among the traditional vaccines that has a limited period of time between 6 months to 12 months. And it could be less depending on having the external factors like the variants and the variance between immunity between bodies from one person to another. So we found it necessary that according to the factors in the Kingdom of Bahrain and the previous studies, that there is a need to use these boosters for the traditional vaccines, because we're giving such boosters for the traditional vaccines. So it could be either from the same vaccine or from a different vaccine like Pfizer. And I'm going to talk in details about the confusion here. So just to confirm, the booster dose is used in order to activate the immunity, and not the false allegation is because of the weakness of the vaccine. And this is a fact, by the way. All the other factors are going to be announced, that they will announce for sure that a booster is needed. Like Moderna and Pfizer, they announced the necessity for having a booster dose, but the timing would be different according to their factors. And I confirm that the Kingdom of Bahrain is in continuous contact and direct contact with these companies in order to see the appropriate timing. So that's why we have set a timeline, and the first company we contacted was Sinopharm. And we have received all the necessary information, and we, as usual, we implemented the booster dose, and later we'll do the same with the other vaccines. But let me confirm for the third time that all the vaccines we're using in the Kingdom of Bahrain, the 4th vaccines, have been analyzed for 4 months in 2020, and we announced that all the vaccines, without exception, all the active cases between the vaccinated in the Kingdom of Bahrain is 1 to 2% out of the total active cases. So the difference would be maybe the amount used of the vaccine, and that's why the efficiency would differ in the human body. And out of the proactivity in implementing all the updated protocols in a very studied manner, it has been, or we're going to announce, to limit the registration for the booster doses to 3 months. So we have scientific reasons, if the time would allow me. So setting the time between 3 months to 6 months, and this is, of course, we can change it from time to time because we are really coping with something novel that is changing over time, but doesn't mean like if we're changing our protocols, it means we have lack of trust. No, but we're coping with the updates and the factors we're receiving about this. And this should give us comfort and trust that we are really coping with the information. And so we chose 3 months for those with chronic diseases and they have weak immunity. And with like the elderly citizens, those with obesity, and we have really defined the obesity, the definition according to the weight of the human body. So these have been identified. Instead of having the booster dose after 6 months, they can have it after 3 months, because their immunity will be weaker in less than 6 months, because there are variants actually in real life. And we've left the 6 months for the other categories because their immunity will be within 6 to 12 months. And for the recovered, and it's really important to note, those recovered, it has been announced, who took the vaccine, there is difference. When did you have the infection? Maybe someone had it in 2020 and maybe another one in 2021. So the virus in 2020 was different than the variant in 2021. Therefore, the protocol was updated by saying like those who took the vaccine and they are recovered in 2021, it means they don't need to take the booster. But if you had the infection in 2020, and even if you took the 2 doses, it means you still need the booster dose. And this is the reason for defining the recovered. I hope that I tried to simplify the definition of the booster dose and the cases where we're using them. Now, I'll leave the floor to Dr. Jamila Salman, who's going to talk about a very important pillar, which is the 4th pillar, the most recent updates regarding the vaccination in Bahrain, especially for the teenagers and children. Thank you very much, Dr. Manaf Al-Qahtani. Now, let me talk about the 4th pillar, the updates regarding vaccination for all age categories, especially for children. First, it has been announced that Bahrain has surpassed 1 million doses for the first dose. So we have from 16th of December 2020 up to the 2nd of April 2021, we have achieved 500,000 doses. And up to the 5th of June, we have reached 1 million doses for those who took the first dose. So we are working towards achieving the herd immunity, but we still need the collaboration of everyone by registering to take the vaccine or for the booster dose as announced by Dr. Manaf. So far, 19% of those qualified for vaccination did not yet register for the vaccination. That's why we call upon them to register in order to achieve the herd immunity. And we emphasize the necessity to comply with their appointments because non-compliance is still high, and this affects the the facility of providing the vaccines. The second point, the vaccines for those aged 12 to 17, they constitute a large number of young people in Bahrain, and they are mostly exposed to the virus, and they can transfer it to their fathers and to their elderly. That's why vaccinating them is very important, and it has been effective as announced by the studies. So in order to protect their health and their surroundings, we call upon the guardians to register their children in order to get the vaccine and take the vaccine very soon. And allow me now to talk about this as a mother. I sent my message to all the mothers and guardians to neglect all these messages they receive on WhatsApp or in social media, which are hindering them, allegations about vaccinating children and that this is not right. I advise them to take the information from the right sources. Our kids is our responsibility. We have to protect them, especially in this exceptional circumstance with this pandemic. So protecting the health and well-being of children is by registering for the vaccine. And let's remember, our children, they took previously more than 10 vaccines when they were really young. And they took even like over 2 to 3 doses. So to conclude, what we have achieved of positive results was as a result of the collaboration of everyone, citizens and residents alike, by committing to their responsibility, taking the vaccines and implementing the precautionary measures. So let's continue within the same line in order to achieve our objectives. Now, I'll leave the floor to Dr. Walid Al-Mana to answer the questions raised by citizens and residents. Thank you very much, Dr. Jamila, and also thanks to Dr. Manaf Al-Qahtani. Now we move to the fifth pillar of the press conference, which is about answering the inquiries raised by citizens and residents from different platforms, whether from email that we have allocated for this yesterday or for the frequently asked questions on social media. Now, the first two inquiries. The first, why not canceling Sinopharm vaccine? And when citizens who took the Sinopharm vaccine will be allowed to go to the other countries? Well, there are so many inquiries about Sinopharm. First, the vaccine is approved locally and internationally by specialized entities like the World Health Organization and other countries as well, and international scientific magazines. And our team has a role as well. You have to trust because we have really verified this after the clinical trials which were published on magazines. So we had the concern. We're working day and night to ensure these information, and they are approved not only like locally in the Kingdom of Bahrain when we did the clinical trials, but also supervised and monitored internationally and approved internationally as well. So thank God things were going fine for this vaccine, and this is our aim in Bahrain, that vaccine should be safe and effective. Well, the travel procedures to other countries is something administrative, and it is up to the sovereignty of other countries, and we cannot intervene to other countries. They have their own decisions. And we have to know there is difference between the medical side and the procedural side. Vaccines are used only after being ensured their safety and efficient by specialized teams internationally and locally. And the decision in Bahrain is not taken only in Bahrain. So there should not be a link, we don't have a link, just we take the decisions based on standards, approved standards internationally, and the procedures of going to a different country is something up to those countries. So those countries, maybe they don't see it as something as a good to have other people enter their countries. So this is up to the other countries. It is our responsibility that we respect those decisions for their sovereignty, and they could change it anytime. The second question, the number of the active cases, the daily active cases, they are still high. And the decrease that we're witnessing is due to the decreasing the number of the tests. So people would say, for example, because we're decreasing the number of the tests, that's why we have the decrease in the number of the active cases. This is wrong. We're not measuring the active cases with the decrease of the tests, because we are implementing a protocol. There are daily active cases we're implementing, like on borders. We have, when home quarantine, we do tests for contacts of active cases. We have tests for those in hospitals or health centers. So these are fixed tests, and we do them in Bahrain from the beginning of the pandemic. As for the number of the tests decreasing or increasing depending on the number of the active cases, the number of contacts. So for example, if the behavior of people at that time, maybe one active case could have 50 contacts, would be just different. In another time, just one active case would have one contact. So the tracing will be different. The number of the active cases, thank God, have seen a remarkable decrease because of the precautionary measures implemented. People always think that there are other reasons that led to the increase, but we were clear from the beginning that it is because of the behavior of people. If they are really implementing the precautionary measures, this would really decrease the active cases. And thank God, over the past 2 weeks, maybe we restricted some activities, and they did not really stop the interest of people, but really led to changing the behavior of people. And hopefully we count on continuing with implementing these precautionary measures. Now leave the floor to Dr. Manaf Al-Qahtani to answer the other inquiries. Thank you, Dr. Walid. Now I move to review the questions I received. I have 2 questions. The questions were related to the importance of booster dose, and I defined the booster dose previously, and I told you the objective of this is it is one of the strategies we're working on from the beginning of 2021, and the objective is to increase the herd immunity in line with the variants existing to up to 70%. So the second question is related to Sinopharm. Is the call for taking the booster dose for those who took the Sinopharm because of that the Sinopharm vaccine is weak and it does not have the efficient protection for the virus? Well, let me remind you that the Sinopharm, the Chinese vaccine, is one of the first vaccines we used in Bahrain. And we started with it in 2020 in November, when we used the emergency use and we give it to the frontliners. So it was the first one used. So that's why it is the time to think about, because it's the first vaccines used, it is time to use the booster dose. And also the inactivated vaccines have a certain period of time for between 6 months to 12 months. So we already know that. We don't need to wait for the company to say that. And we've seen in Bahrain that those with weak immunity, they don't have like up to 3 months of immunity. So that's why giving this Sinopharm as a booster dose does not mean that the vaccine is not effective. No, we have the clinical trials as proof. We have the actual real experience as proof. Those who took the Sinopharm, we had the positive results on them. But maybe the term booster dose is something new to people, and that's why we had some false allegations. They don't have this specialty, because booster dose is scientifically established, and you will hear over time the booster dose for the other vaccines. The third question: what is the extent of the safety of taking another vaccine as a booster dose? So like mixing vaccines, or what is scientifically known as mix and match, or heterologous prime boost. So this is an old science, and it was like there like 1990, and the first one took for the mix and match was for those with the HIV patients, and also for other diseases like Ebola. So it's not a new science, and we had previous trials. So mixing these doses, which is like the antigen, in order to create the immunity of the different cells of immunity. We have different cells of like 3 cells of immunity in the body, in order to enhance the efficiency of these cells, especially the T cell, the memory T cells. So mix and match is one of the largest strategies used previously, and currently we're waiting for more. We have studies presented in the UK, and there is actual implementation in Canada and also in Germany and in France. So Bahrain was like among the top countries in terms of mix and match, in light with the information we have in Bahrain. And Bahrain has always been among the top countries in taking the, we have to be proud in Bahrain implementing mix and match. So it's not new science, and we're not like saying like we're doing trials over people. We have implemented it for a group of people in Bahrain who approved to take the trial, and we have the efficiency of it for the past 4 months. Now I'll leave the floor to Dr. Jamila Salman to answer the other inquiries. Thank you, Dr. Manaf. Now the question is, what is your explanation behind the increase in the number of death cases and the number of infected people in the ICU? Although we have reached 1 million doses and the last announcement of the closure of certain activities, well, there are different reasons for the death rates. It is related to the number of the active cases. So this is what we have known. If you have 100 active cases, 80% will be mild symptoms and 10 to 15% will have medium to severe symptoms, and they will be admitted to hospital, and 5% will be like going into ICU. So if you have 100 active cases, will be different than having 1,000 active cases. As for the death cases in the Kingdom of Bahrain, is among the least rates globally because of the treatment protocol and the early inspection and tests. And there are other reasons as well. We're talking today about COVID-19. We know that it is mutating, and we have variants, and these variants are spreading quickly, and the infection rate is quicker and larger, and that's why some people are going into ICU and death rates. So why do we have an increase in the active cases? As mentioned before, we need to implement the precautionary measures. We've seen that with the increase of the vaccines and with the closure previously, we've seen the success of these plans in reducing the number of the active cases, and it's important for people to implement them. And the question is why we have the increase of the active cases even with the million doses. We mentioned before, the virus COVID-19 is the virus that is going to exist internationally. It's not going to be stopped. So having the doses will really help in reducing the cases, but at the same time we need compliance with these precautionary measures. So if you got the 2 doses and if you finish the 14 days, you should still comply with these precautionary measures, because this would lead to decreasing the active cases, and this will decrease the death rates and the ICU patients. Now, we thank the speakers for their briefs. Now we'll have the questions from the journalists and reporters who are joining us remotely. First question from Al Watan newspaper, Hudayfa Ibrahim to Dr. Walid Al-Mana. What is the percentage of people taking the vaccines, before the vaccines in Bahrain? Thank you for the question. I think from the beginning we talked about how we had an increase in providing doses up to April, like it was 500,000, and now we completed them 1 million for the first dose. So we increased them to 500,000, and this is a good proof that we have people taking the vaccines. All the vaccines of all types are available, and this is a blessing in Bahrain. People can choose any type of the vaccines, and this what has been presented. People can select if they want to register. They can see the variety available, and it is within a very short period of time. They can take it even within days, and sometimes even within a couple of 3 days. So we have a large number of people registering, and we wish to have them more according to the availability. Question from Akhbar Al-Khalij to Dr. Manaf. Has the treatment protocol changed for those recovered? Because some were informed that they don't need to take the booster dose, or they only have to take the first dose. This is a very important question. My answer will be, let me just, to make it really like simplified and not complicated, I'm not going to use the scientific terms. In order to answer the question, let me explain 3 things. First, the definition of the recovered, and is there a difference between a recovered who got the infection in 2020 and a recovered in 2021? The second point, is the recovered took first dose or 2 doses, or did not take any dose? And what is the period of time for recovery that is allowed for them to take the vaccine? So based on these 3 factors. So number 1, if the person is recovered in 2021 and took the 2 doses, whether in 2020 or 2021, the importance of infection. If the infection was in 2020 and you took 2 doses, you don't need any booster dose. And this was based on Nature magazine in 2020. It clarified that those recovered and they took the vaccine, they would have a long-term immunity. So activating the vaccine and activating the natural immunity. But what if a person took 1 dose and then got the infection? Should he take the second dose? Does he need to take the booster dose? If you took only 1 dose, you have to complete the second dose. And the definition will be once you are recovered, because you already took the first dose. So once you are recovered, like 2 weeks, and you finished like first dose, 20 to 21 days, you take the second dose. But if the person did not take any dose and he gets the infection, then you have to take 1 booster dose, because the booster dose will be for those who did not take the vaccine before, and it will be 1 to 2. Pfizer will be 1 dose, because it's the only company that explained that the 1 dose for the recovered will be enough. But the other companies did not announce. That's why for those vaccines other than the Pfizer will have to take 2 doses. And we have said 3 months because we're giving the body enough time to recover from the virus, because it will differ from one person to another. So after 3 months, you can take the booster dose. So the confusion was about the time. 2020 will be different than the 2021. And as I explained, the variant in 2020 is different than the one in 2021. So those in 2021, will be different. For those recovered in 2021 and 2020 will be for a different variant. So the confusion was because of this, and as people say, science is huge and expanding, and the updates are ongoing. So the ongoing of the updates doesn't mean like there is confusion. I hope I have clarified the answer because it really needs explanation. Thank you very much. Question from Samahar Saif, Al-Watan newspaper, to Dr. Jamila Salman. Doctor, what is the reason of having the death rates and the ICU patients in a high percentage, especially among young people? I think we answered the question as we mentioned, because it's important, so we answered the question. Thank you, doctor. Question from Raji, GDN, to Dr. Walid. Today we are witnessing a remarkable decrease in the curve of active cases. What was the main reason for this? And what is the current challenge to not to have the active cases high again? Thank you for the question. Just before I answer the question, we presented in the press conference that as much as possible we answer the questions. Well, previously, those who are attending the press conference, who are raising the questions, they tried to present the most commonly questions, and now we have a clear channel. You can send your inquiries on social media or on the specific email. So we're going to collect your inquiries and answer them. So if it was not raised by your brothers and sisters, the journalists, you can answer it. You can send them immediately to us. So yes, so answering the question, we mentioned there was the main reason, the closure of certain activities and places. It contributed to the decrease and also enhanced and improved the commitment of people towards the precautionary measures. And that's why the active cases decreased, and it impacted also, the curve of the active cases. And I think complying with the precautionary measures was the main reason for the decrease, and thank God we had this. So what is the challenge? I think we are extended the decisions. So the challenge is now up to people to continue their commitment, and they have to be clear to people that they assess the situation, their individual responsibility within the society by complying with these precautionary measures had really had a positive impact on society. So the responsibility individually in society is important, and this is the huge challenge for us over the coming period of time. And hopefully we're going to decrease the number of the active cases. And the second challenge is the vaccination. Vaccines is a great weapon. We have to use it. So the National Medical Task Force, under the directives of His Royal Highness the Crown Prince, to have over 31,000 doses given on a daily basis in over 31 centers. This is by itself is great efforts. So in response, people should take the initiative and register for the vaccine and take this in as soon as possible. Thank you. Well, thank you. The remaining questions has been answered during the press conference, and therefore we conclude the question and answer section. Thank you very much, the speakers, and also thanks for you for watching and listening, and for the journalists. And before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Wish you good health. Thank you very much.